So the first technique we're going to do is rocking. This is a nice, gentle way to introduce yourself to the person, get their body moving a little bit, see where are things moving and where are they not. The goal with this is to have them moving from head to toe. It's not an aggressive thing, but we want to see movement everywhere, essentially. So what I'm going to do is I'm going to place one hand between her scapulae and one hand right across the base of the sacrum. This table is really low for me, so I get to do a leg workout. But we want one leg bent, and that should be your back leg. Everybody likes to put themselves in a lunge, but in a lunge, your back leg is straight. And if your back leg is already straight, it can't really push. You can just fire your calf to push. So a straight leg can't push, so I don't want my back leg straight. I want it bent. I'm going to split the table because this one is so low. If the table is up higher, you can stick your leg under the table and do this just fine. But I'm going to come to the corner a little bit. So I'm going to start with more weight back than forward. I'm going to place my hands here on the base of the sacrum and between the shoulder blades. And I'm going to push my body forward and sit back just a little bit. So my arms are not really moving. They're holding the shape, and my whole body is moving forward and back. Just a little bit. I don't need to move very far. And I'm not really applying downward pressure, just sticking to her body enough to move. So her legs are rocking back and forth with her. Her hips are rocking back and forth, but there's not a lot of movement between the leg and the pelvis. So the hip rotators and flexors and extensors are an area on her I would want to work. We have good rotation here. We have less rotation in the thorax, but you have ribs, so you're going to have less rotation in the thorax. There's some movement here. We're not moving as freely here in the neck as I would like to see. So it's kind of giving me a sense of where she needs some work. You can also kind of get a sense of whether or not the distance between the arms and the torso is changing, if the shoulders are somewhat tight. But we're going to move those around when we work them tomorrow to kind of get a better sense of range of motion and what's stuck and what's not. So the technique is really simple without a person under me. You can see me shift forward to back. Because she seems nice and I don't want to push her off the table, I'm only moving a little bit forward and back to my resting position. I'm not shifting all the way into my front leg or I would shove her off the table. So just a small rock, forward to back. Elbows are down, shoulders are down, forearms are relaxed. I'm not firing any muscles to get myself into position. I want my arms to hang, stick in place, and my body to do the work. Preferably on a table that's not way too low for you. No worries. This is a ridiculously simple technique because you're not moving with your arms at all, but everyone wants to help and move their arms. So think about it like pushing a shopping cart. Nobody pushes the shopping cart away from them and walks up to it. Well, nobody that has functioning legs. People who have mobility issues do that. They use it like a walker. But the rest of us just hold it and we move our center by walking. The same thing here. I'm holding shape with my upper body and I'm moving my lower body to make that happen. Your legs are plenty strong to rock a 600-pound patient without doing too much damage to yourself. Just gentle push and release. The pace is completely variable, but you'll notice the different bodies have different resonant frequencies. So you'll push it and it'll rock back towards center at a certain rate. And what I want to do is match that rate. I don't want to be pushing faster than her body can come back to center, or it's going to feel very weird to her. So if I push and her body gives, I come back at that kind of same speed. And you'll find that varies quite a bit from person to person. If you're unsure, you're not getting a sense of that feeling, go slow. Slower never feels bad. If you're slower than their frequency, you'll be okay. If you're faster, then it'll feel awkward. One of the things this does, besides just let me introduce myself and check out what's moving, is I'm gently rotating all of the vertebral joints. here in the spine. And that's great for the multifidi in particular, which are little muscles that attach each vertebra to 1, 2, or 3 levels above it. And they're super involved in spine injuries and back pain, and they get ignored a lot because they're buried under the erector spinae, and it's really tough to push hard enough to actually affect them without hurting people. But I can gently rotate the vertebra, which lengthens and shortens them alternatingly, and gives me a ton of relaxation in them without trying to squash them to death. The other thing that this does is create a very strong parasympathetic response. Twisting the spine back and forth is also stimulating all of those spinal nerve roots that come out of the dorsal horn, which is your parasympathetic nervous system. So if you want to get somebody into that zoned out rest and digest, as long as your rocking is gentle and not faster than their body can take, you'll get them to relax pretty quickly. And rocking is one of those things, you will be tired of doing it. It'll be boring to you long before the person on the table is tired of you doing it. Right? If you spend 5 minutes rocking someone, they probably would not complain. I don't generally spend 5 minutes because you're going to see when we switch to some other techniques that we're going to keep that wave-like rocking motion going with some of our other techniques. But 60 seconds of it at the beginning is fabulous. I read a paper where they were saying they think hammocks are so relaxing because that gentle rocking is reminiscent of being in utero and sloshing around. And I imagine this is pretty similar to that as well. So that's all a guess as to why it's relaxing, but I'll take it.